Good to go whenever. All right. I decided not to bore you guys with any 10-minute videos on this one today. But I got some special videos and a special guest speaker in the future. So I'll inform you here. Top 25 herbs and how they can help you. A lot of the stuff's based off of medi-herb stuff and their literatures and studies and everything. So I got some very cool stuff to go over tonight. Before I start here, there's some very interesting things that may affect our office in the future with this 2012 new year here. I want to talk about Obamacare facts here. Millions will lose their current insurance, period, end of story. Individual mandate means less liberty and more taxes. Your health care coverage will probably change anyways. The feds will pick up your treatment. Higher taxes than Europe hurt small businesses. The government can't run the post office. What makes you think they're going to run your health? It's the truth. Now, our nurses are already struggling with this here because they're already losing their rights. You want to work here, you need to get a flu shot. You need to get a flu shot. How come the medical doctors are exempt of getting the flu shots, yet the workers have to get them? We have a lot of nurses stirred up right now, and I got some interesting things to go over that as far as that goes. Now, I'm letting the cat out of the bag. Growing up, or when I got out of high school, I worked at Mount Clemens General Hospital. That's on the east side, closer to Detroit there and stuff. And we had some Canadian patients that popped in there once in a while. And I was be like, you got the free stuff over there. Why are you over here? Like, I'm not going to wait 9 months if I need an MRI or a CAT scan, especially I got something serious. Your health is what you invest in it. So he was over here paying for his stuff to get the stuff done. I've just had a meeting with the guy who works with CMI, who works with CAT scans and ultrasounds, because we got a lot of patients that are completely cash. I don't have health insurance. A lot of them don't have health insurances. Working on deals for MRIs and CAT scans. Kathy, thank you. I met with them yesterday. Cutting deals in half. Half of what insurances are going to be paying and all that stuff. You absolutely go around half of this stuff here. It's unbelievable. Just visited a doctor that I work with out in Canada. He just had twins about a month and a half ago. I go, how's the health care over here? He's like, you got to go for the ER for anything? You're at least going to be spending 9-10 hours waiting for your stuff there. You know, you are what you invest in your health. I can't preach that anymore. And there's a lot more I could get in with that, but I'm going to leave it at that. Dr. Ron Paul says, no single person, including the President of the United States, should ever be given power to make medical decisions for potentially millions of Americans. Freedom over one's physical person is the most basic freedom of all, and people in a free society should be sovereign over their own bodies. When we give the government the power to make medical decisions for us, we in essence accept that the state owns our body. The state will never own my body. I'll fight that to the end. So the patient I had about a month ago, you want to talk about pain? This is on a pain scale of 10. This is probably a 20 plus. This is a kidney stone right here. This is what I help him pee out. This isn't his x-ray, but once in a while on x-rays, you can see little kidney stones on people's x-rays here, because that's a calcification. They stuck him on an ER cart, stuffed him in a corner for 10 hours, and said, all right, we got other emergencies, and you're a lower priority here. He sat there. He's so steamed. I'm not even going to tell you the hospital he was at. That kidney stone right there was 6 millimeters. When I put him on, dissolved it down. When it came out, it was 5 millimeters. It dissolved the edges on that, so I could pee it out. 8 millimeters is the key number. If it's 8 millimeters and bigger, you got to get that blasted or surgically removed. This is a calcium metabolism issue. Some people make kidney stones, some have gallstones, some have heel spurs. If you're not properly metabolizing your calcium or have some stomach issues with acid, alkaline issues, you will have calcium issues like he did. I had a guy that in 1 weekend, had him flush 100 to 150 gallstones when they want to rip his gallbladder out. This is what I put them on. Phos food, hydrochloric acid, MGzyme. Magnesium binds with calcium. Hydrochloric acid dissolves the sharp edges on that. Phosphorus binds with calcium and help metabolize and pull that calcium out of them. If you're drinking the wrong tap water, that lady today, cramps in her legs, massive cramps. That's the simplest home run we'll see in this office. You're drinking the wrong water, I'm going to put you on that phos food, and those cramps will be gone in a heartbeat right there. Dr. Tent's next lecture, the exploding autoimmune epidemic. It's in April. This is key. I'll give you a little secret here. Why are you seeing more autoimmune issues and cancer stuff? More vaccines, more chemicals than ever before. These things turn on stuff. You get sick through your nose and your mouth. When you start injecting things in your blood system, foreign animal DNA protein, your body's not equipped to get sick like that. This turns on autoimmune triggers in people. And if you're lucky, maybe you'll just have allergies. If you're unlucky, you might have MS. You might have RA. You might have lupus. I don't know. They got a million different names for this kind of stuff. We're going to go over some very cool stuff at that lecture. My next lecture in May, Pediatrics 101. I'm done. I'm attacking this very hard. I'm going hardcore at this. Protect your children. I'm going to go over some very cool stuff, some first aid things that you should have at your house if you got kids. Spread the word to all the moms and stuff. I'm going over some very cool stuff. This is a part 1 lecture. My part 2 lecture will be here. It might be in the bigger room because I'm having a special speaker named Mary Toko to come in here. If anyone knows who that is, she's a pure pit bull when it comes to this stuff here. So I got some very interesting things coming down the line here. This girl would be a great referral for us at this office. She's got an atlas out on this side right here. You know which side you can tell the atlas is out at? The good eye will look at you. The other eye will cross in or out. That could be an atlas out of place, or that could be vaccine injury. We won't know until we start adjusting that neck there, but you get that atlas back in place, you watch that eye come right back, and these kids don't stand a chance because right from birth, all they do is rip you out by your head. These are some of the things I'll be going over here. 3 vaccine myths that will make your head explode. A fully vaccinated child should be one of the healthiest children in the world. However, statistics show that children are unhealthier now than ever before, despite having as many as 68 mandated vaccines from birth to 18. American children are far from healthy. I think I'm looking on according to statistics here. Now, this is interesting. More vaccines, more vaccines. All you got to do is look at the statistics. Look at autism. The rate of autism 1990 was 1 in 10,000. Today it's about 1 in 100. You look at this kind of stuff, they want to act like this is all rocket science. We got seats in the front here. Where did this come from? Where did this come from? Well, we got some answers coming up very quickly here for you in the far next future. 3 myths I'll be going over. Everyone's talking about this whooping cough here. Whooping cough. Vaccination prevents children from catching the whooping cough. Flu vaccine protects us from catching the flu. No, the HPV vaccine protects women from cervical cancer. This is a folate B12 deficiency. No one gets sick with the flu during the winter because if you're taking vitamin D during the summer, no one gets the flu because you're all out in the sun. D levels are up. I'll go over some special stuff with this here because that does not prevent anything there. This is my cat here. She's a Bengal. She's very loud. Now, our pets are an extension of our children, and it's amazing working at the office how often I get asked, what do you feed your animal? What do you feed you? I'm like, what do you care what I feed my animal? Well, my cat gets Life Abundance, which is wholesome food. That lady you just saw out there, that's where I get my pet food from. Whole food nutrition, no corn, no wheat, no soy, none of that junk's in her food. When I moved out to South Line, her fur was everywhere, and I swear it was the water. But as soon as I switched her food from the commercial food line, took it all away. My cat is probably more spoiled than most of the children you guys know walking around there. More nourished than that. And I tell you what, you can look at some of these people who own pets, and some of their pets' health ain't that far off from their own health. I know a nurse whose dog's shaking, tremors, seizures, and all that stuff, and the owner isn't that far behind. My cat will be drinking soon reverse osmosis water in the future there too. If I ran out of food, I'd probably put that in a protein shake and just have that versus some of the food that's even out here right now.
You said reverse osmosis water.
On it from our newsletter, go to diversehealthservices.com, click the contact us form and get on our newsletter. If you get the newsletter, you'll find out things like this right here. $25 blood work. I don't have insurance. This is where I'm getting my blood work done. $200 worth of blood work for $25. You can't beat this. This will be on that newsletter. Sign up on that newsletter. If you have Facebook, you guys probably already know that right there because I posted on that there too. We spread this around. We drive them up a wall at that church because we make them work extra harder for their money that day. And I ran my blood work last year this time. I had triglycerides in the 700s. I looked at it, I was like, holy crap, that's worse than most of my patients there. 1 month, brought them down to 171, doing nutritional things. Very simple stuff, and I didn't fit the category. High cholesterol runs in my family. I don't feed on the fear of that there. You Google the French paradox. The French have far more fat in their diet than any other culture, and yet there's less heart attack, stroke, and cancer. Resveratrol, which is in wine they drink a lot of, they contribute a lot of that to that there too. I talked about that in my superfoods lecture. That's a Facebook there. You can find us on Facebook, like us on Facebook. If you guys are on there, you would have been the first one to find out about that blood work because that's where I posted it first. We'll be coming on to the next newsletter next week, so sign up on that newsletter. Spread it all around. Skype. I'm Skyping with patients out of state, far away, this and that. Every time we're like, who does what you do in this state? We try sending someone elsewhere. They're on a million different things. And we don't even know what the heck they're trying to do. It's like, here's the point. Anyone could sell pills. Anyone could peddle pills and sell pills. It's going to be the one who muscle tests and knows what they're doing with the pills that separates us from everyone else and the results we get. It's as simple as that. So Skype, if you know, we might be doing some out-of-state new patients for some people there in the future, but not just yet. Learning how to muscle test. Backed by popular demand. I go over all these things that we find through muscle testing, the 5 most common things: staph, strep bacterial infections, gallbladders, kidneys, disc issues. Diane, my movie star, you want to come up here? Talk about a special case I had of a 27-year-old female about a month ago. I'm going to show you some simple muscle testing. This class is booked up into June. So I'm giving you guys a special opportunity to sign up today for an extra overflow class in the second weekend of February. I can only fit 21 people in that office, and when it gets pretty packed, it's pretty out of control. Wasn't it, Jacob? Everyone loves seeing this stuff, so I gotta go over this stuff. I don't smoke. This is for testing purposes. 27-year-old female. She comes in the office, or fixing her on the side, kind of. Buddy brings her in. She's got dizziness. She's got chest pain. She got this and that going on. She's like, what do you think it could be? I'm like, I don't know. It could be adrenals. It could be heart. I'm like, I don't know. You know, you got to muscle test this stuff. This is what's going to separate us from everyone else. 27 years old. She saw 5 cardiologists. I smoked 5 cardiologists' butts behind their back. This is all I did. Muscle testing. Here's a multivitamin. I need to see if they're strong with the multivitamin. Hold your arms strong. If they're strong with that, the muscle tone's strong. Perfect. I go to my cigarette.
Can you come forward a little bit?
Yes, absolutely. So put the cigarette in her hand. Hold strong, weak with the cigarette. Diane was in today. I put it in her jaw. How's your jaw feeling today?
Thank you.
So I go right to the heart reflex. Arms out and strong. This is all I did with this 27-year-old girl. Put your arms out. This was her heart reflex. Her heart reflex should be strong. Her heart reflex was weak. So I knew, all right, something, I know, it's not your fault. So her heart reflex was weak, so all right, something's up with your heart. I got to find out what's wrong with your heart. I got valve reflexes, mitral valve, tricuspid valve. I got a virus reflex. I got a heart reflex. I got carotid artery reflexes. Just kind of going through this stuff. I was turning off reflexes, turning off valves, turning off things, and seeing what would reverse that reflex of her heart reflex. Everything was still weak. I turn off her carotid artery reflexes, which are active with clots, strokes, embolisms, and things like that. When I turn off her carotid artery reflexes, her heart reflex was strong. I jumped back and I was stunned. I go, how old are you? She goes, I am 27 years old. I go, because you are officially the youngest person I've ever seen this on. I go, you want to know what you're pointing to right here is? Right here? She's like, what? I'm like, you got a little clot in your heart. She's like, really? I'm like, yes. And I could guarantee you one or a few things, maybe three. Number one, you're probably on birth control. Number two, you may have a clotting factor issue. And three, you probably smoke. She goes, yes to one, yes to three. This is blood work. And I go, your cardiologist can't find this because you're so young, they would never expect anything like this. They ran thousands of dollars worth of tests on her. EKG, stress tests, Holter monitor stuff, you name it. 4 days, $80 worth of products. No problem since. She had an estrogen-induced clot and a smoking probably accelerated. You could have a seat, thank you. That is how muscle testing separates us from the rest. Now, these are the two things I put her on, natal kinase and Tenzyme Forte. Those two products, I dissolved that clot right out of her, right behind everyone's back. And they're talking about, well, maybe I should put her on a beta blocker, maybe I did this. They didn't know what they're doing. They're all scratching their heads with her.
Did she quit smoking?
You know, I should have dragged it out more. I think she still is kind of smoking. I don't know yet. If I'm going to run that clotting factor test there, I'm going to run homocysteine, lipoprotein A, C-reactive protein, and fibrinogen. Those are the 4 clotting factors. You got to get those at the office there. Those are the things that are going to make you clot if it's a clotting factor issue.
I don't get the 12, B12, I get it genetically from 8.
Yes, and that's a different issue there. Yes, I've seen that there too. So it's a big issue. Let me save some of the questions towards the end, guys. No one's getting vitamin D right now. The adult dose is 5,000 to 6,000 IUs of that for your kids. You could cut that in half. This is my flu shot. This is my natural flu shot. I don't get the flu during the winter because this is what I take. And right now, we've been seeing a lot of flus, colds, sinus, all the junks. Part of me is coming out of the woodwork right now. All you anemic.
Come out for vitamin D per day for a male.
5,000 to 6,000 IUs of vitamin D a day is a dose. Yes, IUs. All you anemic people out there, I'm going to look at your nails. All you white-nailed people out there, you should be nice pink and red. If it looks like someone's pressing your nail, I can find that on a reflex. These are the cold people. You need to build up your blood count. And it has been much of a winter here this year, but fair food, chlorophyll, B12 are things to boost your blood cell production and warm you up during the winter. New Year's resolution, everyone wants to lose weight and do all this kind of different stuff here. If you're going to do anything, a standard process 21-day cleanse is pretty simplified. You can pick up a packet at the office and follow it. It's pretty easy. Got the HCG diet and question mark there. Some people like to kind of combine them both. If you want to lose weight, that's a good combination in there with that. If you want to do more of the cleansing and detox, we preach this here. You want to keep your detox pathways open. This goes on to this cancer stuff, autoimmune stuff. You don't want your liver pathway blocked, and I'll go through some things later in the lecture about that. All right, here's your food chart. You got foods, you got superfoods, which was my last lecture, and you got herbs. There's some rules about herbs that you need to know. Rule 1, herbs are medicine. Medicine. You got food, you got nutritional value, vitamins, minerals to food. Herbs are medicine. Herbs do not have nutritional value like food does, so we use them like medicine. And what's funny is we fix about 90% of our patients with food, whole food products. A lot of people think, oh, you use a lot of herbs. No, we don't. Most of the stuff you guys take are all whole food products. You could take a bunch of the whole food products and not get stomach aches. herbs, you gotta be a little bit more careful with, and so many people are on medications, you know, you gotta kind of play that whole game. American herbs are no good. The best herbs are found where they grow naturally in their native habitat there. For example, Spanish moss here, southeastern USA, milk thistle, Mediterranean regions of Europe, ginseng, northern hemisphere, Korea and China, turmeric, tropical South Asia. If you want the best herbs, you got to go where they grow naturally. MediHerb, which is the company I'll be talking about, gets all these herbs where they grow best in their natural habitat. It's as simple as that. When I look at the back of these bottles and I see USA herbs or this and that, or where they're manufactured at, most of them are junk. MediHerb, I'll talk about that here too. The part of the plant is absolutely key of what they use. It's hard to see here, but you got the flower, you got the leaf, you got seeds, you got the fruit, and you got the roots. Different things, you're going to use different properties for the results that you're wanting. And MediHerb is owned by Standard Process here. It's a factory in Warwick, Queensland, Australia, about 95 employees. Australia is the largest producing plant of herbs. Partnership with Standard Process. Standard Process owns them. This is all American products here. I tell you what, you want to buy American products today. It's just on Grand River, and I don't know if everyone's seeing them picketing because Walmart's putting up a shop there, and they're using their own workers, bringing people in instead of using local workers around here. They got everyone stirred up in the community with picket signs on Grand River right now. Australian laws. Herbal medicines are regulated as a subclass of drugs. All herbal products must be made under pharmaceutical GMP. You are getting full high doses. These are all medicines right up here. Full strength of things here. Therapeutic disease claims are allowed. All products must be registered with the government. MediHerb is in Australia there. They are FDA regulated. Things you should know about drugs. There are 25,000 prescription drugs and about 200,000 over-the-counter drugs on the market. Americans consume over half of all the drugs in the world, equaling to a rate of 25 million drugs per hour. That's sick. The average American family has 29 different drugs in the home. I don't believe that. That might be a little higher. 106,000 Americans died last year from properly prescribed meds. I think that's too low. There's a lot of medical errors that do not get calculated. I've seen that stuff firsthand in a hospital. I guarantee you that's low. That seems a little too high, but I guarantee you that should be higher there.
That 106,000 Americans, would that be considered murder? Serious.
Yeah, it's. You think you see every commercial today? Hop on this lawsuit. Hop on this lawsuit for this medication. Avia causes this. This medication causes tardive dyskinesia. I've seen the errors in the hospital from medications when someone's got sitting down, they got a leg that won't stop. They call it tardive dyskinesia there, and their leg can't stop. We're like, what do you think we're going to do for you? That's from your medication that whoever put you on. Go hop on one of those lawsuits. We can't do anything for that. And I've seen 4 in the last year. So more of this is coming around. It's not fun stuff. And this is the Lancet. A 2% improvement in the prevention of chronic disease would avert 36 million needless deaths by 2015 there, with a gain in about 50 million years of life. Prevention, people, investing your health. You could have money in gold, stocks, this, that. As soon as your health goes down, all that means nothing. Historical content of herbs. They've been around for years, pretty much. Physical evidence dates back 60,000 years. All cultures have traditions of herbs for healing. You see the dates back here. This is interesting here. 25% of prescription drugs are derived from plants. I'll talk about this here. Valerian is a very prime example of this here too. 80% of the world population uses herbal medicine for their primary care, where in the United States it's probably about 80% use pharmaceuticals here. My first herb I'm going to talk about is green tea. Green tea and cancer prevention. A review of 26 studies and clinical trials over the period of 1974 to 1997 found some conflicting results, but an overall positive association between consumption of green tea and protection against various types of cancer. When it comes to herbal things, there is so much literature about green tea and cancer. It's unbelievable what's out there. This is our anti-cancer supplement. Green tea and cancer prevention. The review found that an intake of green tea was more often linked to reduce a frequency of cancers in the following types: colon, bladder, pancreas, esophagus, and lung. This was interesting. The Japanese people have a high occurrence of smoking but relatively low incident of rate of lung cancer, and they say green tea is their thing. They all drink green tea over there. They're correlating it with the green tea. Yes. Green, and this is another one just talking about green tea and lymphomas. Here's the key product. The EGCG right here is the main component of the green tea that has all the anti-cancer properties to it. This is one of the strongest antioxidants out there. To induce apoptic cell death in leukemic B cells, that's just with that, and talks about the lymphomas, and here's your source here, but this goes all with all the different cancers there. This was a tragedy here. Joe Paterno just recently died there a few days, or was it a few days ago, Sunday? 85 years old, lung cancer. You know what my treatment would have been? Leave it alone. Leave it alone. Why are you going to put an 85-year-old man through chemotherapy? The chemo killed him. They won't say that in the news, but the chemo killed him. My mom's a nurse in the oncology unit. She has very good cancer. I'm not dealing with the chemo. She's like, it kills most of the patients. The treatment kills them. They can't survive the treatments. 85 years old, in the lungs. Leave it alone. What are you going to do? But as soon as someone hops on an alternative thing and they die, oh, it must have been the alternative treatment that killed them. Steve Jobs, and pancreatic cancer does not have good results in any way you treat it. He went downhill very fast, and yet, oh, it must have been the alternative stuff he was doing. He was doing alternative stuff.
Then who's saying that?
The news,
About the alternative?
the media.
Oh, okay.
Green tea and dementia, this is just my last study of this, just talks about people consuming more green tea and there's less dementia here. You're seeing an increased rate of dementia today. I'm telling you right now, pharmaceutical-induced dementia, too much over-medication, everyone on statins, your brain's half fat, half cholesterol. You keep pounding these statins, sucking fat from your brain. You just watch that brain just go downhill just like that. Run a hair analysis. We run these at our office all the time. I tell you, 2 out of 10 come back with a clean one. Everyone's slowly getting whacked with something. People aren't digesting their foods. They're not picking up their minerals for the brains. Mercury, aluminum, lead, it's all going to pollute your brain, yet they will never find that. Absolutely never find something like that. Rosemary. This is key right here. This is the only herb. Rosemary protects against electromagnetic fields, EMF. This is a British Journal of Radiology. You don't hear much about this, and this is a huge issue. I don't have my Q link on me. Normally I have my Q link to talk about this kind of stuff here, but everyone is walking in a sea. Everyone right now, you're all under these lights and you're all swimming in a sea of Wi-Fi. Everywhere you go, you're in Wi-Fi. There's more infertility issues. There's more issues with brain tumors from cell phones. More literature saying if you're on a cell phone for 30 minutes or more, there's more of these glioblastomas, more cell phone tumors than ever before. And we're all in a Wi-Fi. I never realized how much Wi-Fi I was swimming in until I'm carrying around a smartphone, and everywhere I pop up internet, like, which Wi-Fi you want? You're under 5 Wi-Fis right now. It's like, great to know I'm being fried by all 5 Wi-Fis right now. All interesting stuff here. But that is one of the only herbs that protects you against EMF. Turmeric, you hear about this all day long. Now, dementia and stuff, this is one thing that I don't have written on this one here, but turmeric in Alzheimer's, less Alzheimer's in people who use turmeric. This talks about more of the anti-inflammatory process that it stops by the inhibition of the arachidonic acid cascade via 5-LOX enzyme. We get all scientific and stuff. This is the anti-inflammatory process of turmeric that helps out a lot. They've done studies showing that inflammation in the arteries in the brain and dementia and things like this, turmeric stops that inflammation. All 4 of those things I just talked about are 3. Here's the 4th right here, grapeseed extract. This is something that protects the capillaries in your blood vessels here. It's an antioxidant, collagen stabilizing, vasoprotectant, venal tonic right here. This right here works, supports the connective tissue by protecting the collagen and elastin within the microvessels. I tell you what, you hop on statins, you hop on blood thinners, these vessels just burst like they're nothing. All 4 of these things you could find in one product. The MediHerb Vitanox has your rosemary, your green tea, turmeric, and grapeseed. Now there's grapeseed and there's grapefruit seed extract. 2 differences. I'm not going to go over the other one, but that's a different grapeseed right there. This is the first thing I take along with my Cruciferous Complete for my detox pathway. This keeps my liver pathway open doing those, my cruciferous vegetables, whether it's a green drink or in the green pills with my Vitanox, works on the phase 1, phase 2 detox of my liver. I'm not doing some crazy fad diet 1 week out of the year to cleanse my body and this kind of stuff. I'm doing it daily. We're living in a sea of chemicals. We're living in a sea of estrogen. If you don't stay on top of this stuff, you can get behind it. Look out. And I tell you what, you can tell the people who got their liver pathways blocked up, you take an antacid, you take an antihistamine, you take certain antidepressants, painkillers. 1 drink of alcohol on some of those medications is like 5 or 7 drinks. You have 1 drink, you're slurring. Like, oh, you had 1 drink. It's because your liver's so backed up on that medication. That's like 5 or 7 drinks. You block that enzyme, that P-450 cytochrome thing in your liver, you're going to spur any cancer in your body. You need to keep those pathways open. I do simple stuff to detox. I don't have to go through crazy things. I don't have to starve myself and be angry at every person I see because I'm going through a cleanse. I'm doing the simple stuff. This is one of my favorite products here, rhodiola. Traditional uses was used as a tonic and stimulant to increase endurance, memory, productivity, was used to treat fatigue, depression, impotence, seasonal affect disorder. All you people that hate the winters, this works great. A ton of more of literature in supporting people with high cortisol issues, cortisol and adrenal stuff here. This is one of my favorite. Stimulants in their life. We're all tired, we're all fatigued, we're all sick of this crap. You need to play the stuff properly and you'll feel good. And there's no iodine in today's Michigan soil. We live in a goiter state. There's why there's all this hyperthyroid stuff today. Guy, new patient said he had a hyperthyroid issue. It's more common in females than it was in males. I had to kind of go over this little lecture with them. And one of there's no such thing as a synthroid deficiency, but there is an iodine deficiency. Iodine powers that thyroid. You need to play the right things. This is one of my favorite ones. Several early clinical studies here just demonstrated the alleviation of fatigue, reduced work capacity, insomnia, things of that nature, physical and mental stress. This is the key thing. Your body's adrenal glands cannot decipher the difference between mental and physical stress. You use rhodiola and it helps you battle this work fatigue. This is one of the products here. It's got the ginseng's great. The Chinese and all that use a lot of ginseng. This is another product right here, ashwagandha. That's another thing too. Herbs work best kind of mixed together. So a lot of many herb products you'll see multiple herbs together. And right here you see the Korean ginseng root with the skull cap and ashwagandha and the licorice right there. All these work together. Now to see which one you test best for, it's best if you muscle test it. There's a whole bunch of different products and herbs and ginseng and I had to go through, I would love to do them all. I try them all. That's one thing that's cool. When you come to our office, let me tell you, hop on this pill. Dr. Temp, I've done most of those pills. We don't just blindly say, hey, try this, see how you feel. We've done most of those pills. We know how you're going to feel on it. I would love to challenge a medical doctor to take out the medications they got their patients on, see how much they feel like crap, and they might not prescribe so many medications to the patients when they're on this beta blocker. I've got no energy, I'm tired, I'm lethargic, I got to take naps all day long. Get all the crap you're on, you're on 8 different medications. Who's going to feel normal on that? Simple stuff. You got to change. Those come off. Technical ears. When I go through training, different regimens and stuff, I like to play my herbal stuff, rhodiola ginseng, some very cool stuff. It's one of the products, but like I said, you got to use the right ones here. It's a tonic formula that boosts energy, assists with maintenance, improvement of general well-being and energy. I love my energy stuff because my moods follow my energy. It's as simple as that for me. Alleviate nervous tension, stress, mild anxiety, helps you deal with this kind of stuff, gives you more endurance and stamina, bottom line. Now, eleuthero right here. Now, you look at this one. This is a different type of ginseng. This right here is Siberian ginseng. So you've got many different ginsengs. What works best for you, you got to be tested for it. And I tell you what, man, the rhodiola just works awesome for me. I'll go in between using that, some conjugated linoleic acid, the Super CLA, and I tell you what, it's awesome. But this is a different one. This one I find that works better in the work habit, you know, the work stress, the mental fatigue stuff. The Siberian ginseng seems to work better for those patients there. And this just goes back, the adaptogenic activity of a eleuthero root was demonstrated by the Russian scientists back in the 1950s. In the 1970s and 80s, it was used by Russian Olympic athletes as for stimulus and help them with this stuff. It's simple stuff. This is natural herbal stuff. That's, you know, these aren't drugs here. Natural stimulants to help you with the fatigue, the stamina, the endurance. And athletes were onto this way before anyone else was. Yeah, you like that? We got Fielder now. Should be an interesting year this year. He goes back to exhaustion, the fatigue, insomnia, mild depression, covalence, stamina, endurance, mental and physical performance improvement. Simple things, different herbal things. You just got to know how to use them. You got to see which one you're tested for to see which one's going to work best for you. Can't stress that enough. This product's awesome. I'm going to teach you all today why garlic has to be enterically coated. Now, you want to look at hospital-induced infections like MRSA, C. diff, things like that. When antibiotics aren't helping out your infections, this is one of our secret products that we kick their butts and smoke those infections out of them behind their backs when their antibiotics don't work, and this is becoming more of an issue because of the overuse and prescribed antibiotics. There's an enzyme in here. The alanine is converted by that enzyme to allicin right there. This garlic is 5 grams of garlic. This is enterically coated so it gets past your stomach and then breaks down. If it's not enterically coated, the stomach acid disrupts this and you don't get the full beneficial factor. I smoke heavy yeast infections with this stuff, the C. diff, the MRSA, all those hospital-induced infections. This is one of my assault products right here. Dr. Tent used that to get at that bone graft infection in his face. This is a very cool product. That you can there too. What's kind of cool with that product there, you won't smell like garlic with doing the cloves there because that breaks down and then everything you do, garlic house, they're walking around. Now, garlic in the literature and that stuff says helps lowering blood lipid levels, preventing coronary artery disease, atherosclerosis, hypertension, issues with peripheral circulation, respiratory relief. We use this a lot right now, modifying bowel flora with the fungal yeast, bacterial issues. That works great because you take antibiotics and it kills bacteria but increases yeast issues in people. You take antifungal medications, kills the fungus but increases yeast issues or bacterial issues in you, where this goes at them both equally. Now, we're going to use this a lot right now with this respiratory issue because everyone's got these nasty coughs that they're not getting, or these wet coughs. We're going to prevent people going into that pneumonia state by roasting this stuff out of them with garlic. We play that about 4 to 6 pills, depending on the patient, how wet that cough is, what they're coughing up, yellow, green, whatever color. That's the pill we're going to use to roast that out of them. We don't get too much into promoting it. Oh, your cholesterol's high, you should hop on this garlic pill. It's not a garlic issue. Don't be scared of your cholesterol. This is a pill that we underutilize in our office here. Echinacea, it's my number 9 pill. You want to know if you're taking good echinacea or not? Your tongue will tingle when you take real echinacea. I've taken this in pill form, and this is the pill form here, and liquid form. Your tongue, mark my words, will tingle when you take real echinacea. This here, you got to use the quality and dosage is the whole thing. You know, when they come out with studies and say, well, echinacea really never worked for this placebo group, and you know, people who were taking this, it really didn't help their colds or anything. Number one, they didn't use the right part of the plant. They didn't use the right quality one, and they didn't use the right dosage. Dosage is everything. You want to get the real results, you got to use the real stuff. The FDA is not going to fund this stuff because they're not going to get money from herbs. The money's with the pharmaceuticals. They don't bite the hand that feeds them there, but they will put things like that out to make things like this look bad. The Chinese and India traditions use about 3 to 6 grams of the whole herb there. They go at that hard. They don't mess around. Americans are scared to kind of hit this here, but you know, 1 to 6 grams is about what the literature supports as far as you know, the dose on that there. We're gonna muscle test that. We're gonna 1 pill, 2 pill, 3, 4. Well, you check for 3 pills. Your dose is a 3 pill. You can use 3 pills. Watch that. Get that out of you. That one works really well for me. I like my echinacea myself, and you'll see in some of the other products that I go through that echinacea's in a bunch of those too. They call it a miracle herb. Echinacea, a miracle herb against aging and cancer. It's just a little study that just shows that helps boost the natural killer cells. We've got a lot of things that helps boost those natural killer cells and increase your own white blood cells. IAG, I'll go through another one, astragalus. Sometimes we'll use a combination of things, but you want a strong immune system. Last year, man, I was training like a dog doing that P90X, and I drove my immune system in the ground. I had 5 colds in 1 year. I was like, that ain't happening this year. The heck with that P90X. I'll do a little bit of a lighter regimen, pound my D, start some of this kind of stuff earlier, build my immune system up, and I've been good. Simple stuff. A lot of things we do at the office is fine-tuning people. It's not that hard. Andrographis is the next herbal product, number 10 here. I like this because in combination with echinacea and andrographis, if we're getting behind on bacterial infections that aren't responding to what we're doing, we're going to use a combination of that andrographis and echinacea together as our last resort to really help pound this stuff out of you. We got to use, I'm not going to talk about it here because it's not a Medicare product, but we use a lot of grapefruit seed extract to kill and sterilize blood infections that are hospital-induced foreign. I just had a patient that came back last week to me. She's like, I just got back doing some missionary work, and she was telling me, I didn't get the vaccines like you told me. I did that grapefruit seed extract, I did the pro-symbiotic, but my friend who was with me in this whatever country she was in, we were both getting bit by mosquitoes. We slept in the same room. She got malaria of the brain. The malaria attacked her brain, and we were both sleeping in the same room, getting bit by all the same mosquitoes. And she's like, I absolutely contribute to what you put me on. I sterilized her bloodstream, and she did not have to take the vaccine stuff. I've seen people whacked by these vaccines, missionary people Peace Corps workers, and military. They're going to be some of the sickest people that you'll see from vaccine injuries. Side effects. I want to get back to Andrographis here. It's one of our assault products here when we're getting behind on some of these infections here. Acute infections, viral, bacterial, parasitic. Chronic infections, infection prevention. Intestinal worms, hepatitis. You know, we're going to use different things in herbal things for parasites and that, and I'll go through some very interesting things towards the end of this lecture here that you don't want to see come out of you. But we're going to, yeah, Andrographis is more for that bacterial thing that we're going to use that we're getting behind on here. And they say it's a key herb for acute infections and it supports the immune system there. We use more of the astragalus versus the Andrographis for prevention of infections, and that should be my next one here. Astragalus. Astragalus and the Biotics IAG is what we typically use to help boost the natural killer cells. You could use the astragalus, you could use the echinacea, you know, pick what works good for you. You know, I like to kind of mix things around there. Astragalus is more for, why is it doing that now? Alright. You know, I tell you what, I could never get astragalus, providing restored and enhanced immune response, enhanced recovery from infection, enhanced response to stress there. You know, I tell you what, stress today is huge. And you look at, I got people that just called me from Florida, some of our patients, got shingles. This is breaking out. That's viral in nature. When your stress goes up, your cortisol goes up, your immune system goes down. That's when that virus comes out of that nerve and causes that shingle there. You don't need a shingles vaccine because that's not effective. If you had chicken pox before, that virus, when you get chicken pox, that herpes virus hides out in your nerves right back here in that dorsal root ganglion. Your body does not attack that herpes virus in that nerve, or that would be an autoimmune disease if it was attacking the nerves. It's a smart virus that knows your body's not going to attack it right here, so it's going to hide out in that nerve right there so it doesn't get attacked. Now when you get stressed, your cortisol goes up, your immune system goes down, your defense system's down. That's when that virus comes out of that nerve and causes that lesion there when your body wakes up and finally attacks it there. That's shingles 101 there. Bilberry. This is 6 grams of bilberry. Now, this is huge for the eyes. If I had a diabetic relative, this is going to be one of the first products I'm going to have them on, because when you're diabetic, your eyes, your kidneys, and your nerves are the 3 things you've got to babysit, because those things downhill like nothing right there. Come on. Visual fatigue, eye strain, vision disorders due to altered microcirculation of the retina, including myopia, retinitis, glaucoma stuff there, improved night vision. You know, the number one cause of blindness are these blood thinners. All your chronic aspirin people, Coumadin, Plavix. You screw up that circulation behind your eye, you will go blind very quickly. People want natural aspirin alternatives. This is a natural aspirin alternative because bilberry, and I'll be talking about ginkgo next, are 2 natural blood thinners. We cannot play this herb on people who are on blood thinners because this will make the blood viscosity a little too thin, and you've got to be careful on blood thinners. My wife and I are sitting up in the front row here. We just got back from Gatlinburg, Tennessee. There's a guy who was taking a picture of his wife, 70 years old, backing up, hit a curb, slipped back, smacked his head. Guy was unconscious, snoring. We just missed it. 5 minutes, we pulled over. You guys need a hand? He's like, yeah, we're up in the mountains. Can't get a hold of anyone on the phone, this and that. The lady's all freaking out. I'm checking his pulse. Pulse is strong. Can't wake him up. He's snoring, supporting his head there. He's bleeding from the back of his head. I didn't tell his wife, but I knew. I go, all right, how old is he? She's like 70 years old. I go, what kind of health conditions does he have? He's got some heart issues, and he's got a heart history there. I'm like, all right. Next question is, how many medications is he on? 8 medications. All right, 8 medications. I go, I was thinking in the back of my mind, I guarantee you it's not going to be the complications from a concussion that he's going to have a problem with, but from a brain bleed, because I can guarantee you 7 years old, 8 medications, heart patient, he's probably on Plavix or Coumadin. So, you know, they had to get a helicopter in there to fly him out. We finally got someone in there, but you know, his pulse was really strong. His breathing was good. You know, it seemed like he was pretty stable when we left there, but complications from a brain bleed's not fun. You know, we're going to use other things with that. You know, if you a simple approach to pink eye, colloidal silver on the eye. And it's somewhat funny you mentioned that. My eye's all screwed up right now from my contacts. I muscle test that. I go in between my bacterial things like Thymex and Congoplex that I deal with staph and strep. And colloidal silver topically works pretty good, but there's a few different things you could use there too, but those are probably the main 3 that we'll use right there. We don't use this so much for that, and I know it does talk about that somewhere down in here. It wasn't this one, but we don't use it too much for that. This helps protect your capillaries there a lot with the vision. The people who are stuck behind computers all day long, they got these dry eyes. This is the stuff we're going to put them on. Boswellia. This is one of our awesome natural anti-inflammatories right here. Now you can see you got ginkgo in here, or ginger, and I meant not ginkgo, but turmeric right here. Turmeric and boswellia together are 2 strong anti-inflammatories. This works great. A lot of our bodies, you know, with this American diet, we're in this chronic inflammation state. Inflammation, inflammation, inflammation. So one of the natural things that works excellent here. Now, that blocks that enzyme right there. It's got ginger, turmeric, and celery root in here. We're going to use boswellia for inflammation for certain things here, and the things that we use a lot for patients who are they got the osteoarthritis. Now it talks about rheumatoid arthritis, that's good too, Crohn's, ulcerative colitis. We don't use it so much for the gut things, asthma, things of that nature there, and some of the lupus, gout. We're not going to use it for those things. People who are kind of floating on a bad knee or a bad hip that need a knee or hip replacement, we're going to put them on a product like this and see how much we could ride that out until the pain's enough to the point where they're like, all right, I got to get it replaced. This is an awesome product. We got a brand new oil in the office that works great in combination with this inflammation stuff, boswellia, and a high, this Pro DHA 1000. That between these 2 things, inflammation, putting things at a stand hold there. It's great. Great results. You'll get great results when you use the right products. Get muscle tested, see what you check back best for. Like I said, any person can sell pills. You got to muscle test and see what one works best. Cat's claw. I was going to do this thing again. I don't know why it's doing this. I didn't set it up like this. Cat's claw is an awesome product when we are behind on certain infections. We're going to use this one with chronic yeast infections here, fungal parasites right here. We can suppress immunity, post-viral syndromes, HIV, autoimmune diseases there. Helps to counteract immunosuppressive conventional cancer treatments there. I tell you what, between this pill and my grapefruit seed extract, I will smoke Lyme's disease out of someone if I catch it early enough. If I catch it late, I got to use something different. I wish I had pictures of the few patients that came from out of state that have helped with this Lyme stuff that had the bullseye rash on them, that I used that cat's claw and my grapefruit seed extract to whack that out of their system. Just recently, I had a guy who had a red yeast infection on his face. He's an actor, so he's like, does commercials and all this stuff. He's just like, couldn't get over any of this. He's on a million different pills, trying this approach. Cat's claw was the thing that whacked that out of his system. Wasn't the first thing I went to. It was the next step of things I went to if he wasn't responding. We don't go jumping and throwing people right on herbs right away there. We could go through a little process and see what you respond to best there. We don't have to throw the kitchen cabinet at people. We start off with our whole food products, our garlic, our oregano oil products. The ADP works great in that balance of fungal yeast. And you gotta treat people's stomach. Today, a lot of people have dead stomachs, and you kill off all opportunistic infections in your stomach before things go south. So it's proper to have the right pH in your stomach to kill things before things go south. What's everyone on today? Oh, I got everyone's stomach ache. Today's GERD. Oh, went to my doctor. He said my stomach ache was GERD. Everyone's on Nexium, Tagmin, Prilosec, Tums, Protonix, this, that, you name it. All that does is turn off all those cells in your stomach. So now you're not going to absorb your minerals, to be B12 deficient. You won't be breaking down your proteins. You turn off your immune system to your stomach. All those opportunistic infections will go south, and you'll create this problem. That's your cat's claw. Chaste tree, this is more for the females here. In simple terms here, chaste tree helps increase progesterone. Now, works great with the endometriosis, fibroids. We're going to use vitamin D and iodine and a lot of that there too. And each person that we check with those types of conditions checks for something different as far as their dosage. And you need to really go to someone who you know is using the right proper amount of iodine to help dissolve those kinds of things there. Premenstrual syndrome there, fluid retention. You know, it works very good with the women who get very moody around their periods. This is one of the pills that we use a lot with them. Hormonal acne on women. And it says men here too. We don't use that one on men. It's pretty much a female pill. Infertility issues. Infertility. We get great home runs using some other stuff, but we'll use chaste tree in combination with that to help increase that progesterone for infertility. Cranberry. This is great stuff right here. When women were given either cranberry juice or a placebo to drink and had either their urine mixed with strains of E. coli or staph bacteria that can cause a range of infections from skin rashes to MRSA, the cranberry juice stopped both strands from growing and was especially effective against staph infections. Now, if I had a relative or a loved one in a hospital, this would be one of the first things I would have them on, because you see all these old folks with catheters and things going on. These post-infections and induced infections from the hospital causes a whole range of issues. And I tell you what, you get a bladder infection, a hospital-induced infection from a catheter, you are not going to have fun. We struggle in our office with these patients, and they are never the same with their bladder and urination. That's one infection you don't want to get behind on. Absolutely don't want to get behind on. Ginkgo, this is a great, ginkgo for thinko, right? It's an antioxidant, has antiplatelet factors to it there, tissue perfusion enhancing, increases circulation, cognitive enhancer. So it increases the circulation. This is a blood thinner. People that say, oh, I gotta do some type of blood thinner, we're gonna use ginkgo and bilberry as natural aspirin therapy to them. You know, a lot of people, I gotta change out a video here. A lot of people are dehydrated as it is. You're dehydrated, that blood stuff gets a little bit more clotted up. It's easier to throw a clot who's been sitting for long periods of time, but ginkgo and bilberry are natural blood thinners. Ginkgo is also supported in the literature for ringing of the ear. Ringing of the ear with ginkgo is supported in the literature. I can tell you from first-hand experiences, we don't get much results with the ringing the ear with the ginkgo. It's hit and miss. It's hit and miss with that. But it helps reduce nanoplaque formation, and nanoplaques are the first stage of atherosclerosis, with the plaque building up on your arteries. Helps with the circulation and the nanoplaque formation. You can use that for thinking. You know, everyone says, well, my memory sucks, I'm going to use some ginkgo. It's, on that premises, it helps with the circulation and getting your brain and nutrients to your brain by cleaning up some of the arteries and getting circulation to that brain. We're going to use a few different things and check a few other things before we just say, hey, take some ginkgo, take some ginkgo. Had a guy used to see the aluminum level on his hair analysis last week. He can't even remember yesterday. I was like, bring your wife in here so when I go over this, you won't forget. It's unbelievable. The stuff we see on these hair analysis is sick. You don't even know you're sucking this stuff up. Your body's low on minerals. You'll suck up in the environment. Heavy metals replace minerals in the body. If you're deficient on stuff, you will find ways of getting it through the environment there. And the stuff they're spraying in the sky, these chemtrails, you know what's in that stuff? 3 things: high amounts of aluminum, strontium, and barium. You see this stuff being sprayed all over the sky. So if you're low on minerals, you might be breathing some of that in there. Valerian. Now, I got a raffle here, and whoever is brave enough to take some of this stuff could take this home with them here today. This is natural Valium and Xanax. This is where Valium came from. Pharmaceutical companies took the herbal form of valerian and came up with Valium, put their addictive stuff in it, and try to get people hooked on it. This is where this came from. If I want a chill pill and my brain's kind of all over the place, valerian works great. When I first used to do my lectures, ramble too much, this is something that I used to like using a lot. This is awesome. Sleep stuff. This isn't going to give you the over-medicated feeling or the drowsiness. This stuff works good. And I tell you what, I got this, it's one of these bottles right here, and it's liquid form, and it is horrendous. Real herbs are tough to get down in liquid form. I'm going to give you a secret. If you win any of these liquids up here, and you're going to take this stuff, the best way I take this is I'll put some water in my mouth, and I'll pour the valerian on this cap right here, and I'll pour that in my mouth with the water already there, and I'll swallow it down. That's the fastest way you could get that down. So anyone who wins one of these things here, I'm giving you my own secrets here, because you will, and then don't kiss your spouse here, because you're probably going to want to brush your teeth afterwards. But when you use real herbs and feel the benefit of it, you'll understand why this is the real deal in these bottles here.
Do you follow that dosage with more water?
Sometimes with the aftertaste, yeah, I need something to chase it a little bit more, so I'll take some more water. It's number 18 here. We're almost towards the end here. Wormwood. Now I got some very cool stuff for you. All the crazy people down around the full moon. This is the secret with parasites. The people who are crazy around the full moon. Pale complexion, dark rings around the eyes, crabby, irritable, fatigue, stomach and gut pain, itching the butt are all symptoms of parasites. All our teachers know this stuff. In a classroom of 30 kids or whatever, they could all see this, because these kids, yeah, I know. I'm going to talk about this. I know I screwed up on that right there. That's stomona. This is black walnut, wormwood, and clove. The main part I'm talking about is the wormwood here, but all combination of these together work with parasites. Teachers could pinpoint this stuff from anyone. This lecture will be available on an email in 2 more days when I put it on there. So if you're rushing to take notes, if you miss stuff, don't worry about it. I have that on the email for patients, and it's being recorded here too. So you guys will get this information. I just had, when I was in Canada, I was talking to my colleague there. He goes, my little one's hyperactive. Looking at him, bouncing off the wall like crazy. I'm like, first question I go, does he grind his teeth at night? He stood back like, how'd you know that? How'd you know he grind? Yeah, he does grind his teeth at night. How'd you know he grinds his teeth at night? It's a symptom of parasites in kids. Adults will grind their teeth due to stress. Kids will grind their teeth due to parasites. You'd be surprised at what we pass in some of these kids. I had a family. Now, I'm talking about this. One of the basic problems with worm infestation is reinfestation. It could be due to poor hygiene, poor diets, low hydrochloric acid production, low immunity, or a combination of these factors. And a lot of the time it's low hydrochloric acid production. Your stomach's your number 1 line of defense for your GI tract. You don't kill things here, things will go south. Any of you guys have any sushi-holic friends? Oh yeah, look out. If I go eat sushi, I'm popping about 5 pills of hydrochloric acid. I'm making sure I'm killing everything. I find a lot of people who eat sushi have parasites. You want to see one of my buddies who had parasites from sushi? That's a tapeworm right there. I cleared a tapeworm out. Tapeworms typically come from pork, but he had this in him. He's like, he already had Crohn's. He already had a weak gut as it was. So he's wanting me to check him out. I was like, checking the reflux. Now that's on my chart in the front here. My gut reflex. When that arm goes weak, how do I know you've got a parasite? Well, let me check. Is it a cataplex AC? Is it a bacterial issue? If that arm goes weak, well, I know it's not a bacterial issue. Let me grab my parasite stuff. I grab my parasite stuff, my wormwood stuff. Arms strong. Well, you're checking for parasite stuff. I can tell you with confidence it's not bacterial, it's parasites. That's how we check this kind of stuff. Now, I had a family. You want to talk about a funny story? They stick me in the smallest room out. Well, you guys been in the office here. Room 3 is the smallest office in our room. Whole family has scabies. 3 family members in the smallest room in our office have scabies. They're not responding to the medical treatment of what they're using. I'm trying to muscle test them, get in and out of the room and talk and kind of, all right, just take the stuff and get out of here type of thing. And there's a few things that are going to make you itch. Fungal yeast stuff will make you itch. Parasites will make you itch there. I just want the muscle check, see if it was a fungal yeast thing, which is your belly button, or the gut reflux. They weren't responding to the medications and the rid spray and things that they were doing. And the mom spread it to her in-laws and all this. It was a whole mess. I had a whole family of scabies one month. That whole day I was just thinking of it. Look around like crap. One of those things that'd jump on me. That's the stuff that I use to get out of there. Don't send me pictures of what you poop out in the toilet. If you want to send it anywhere, send it to info@diversehealthservices.com because I don't check that email. Then I'll forward to Dr. Tent. Silymarin, this is an awesome product right here. This has milk thistle in it. This is our home run product with a patient who was diagnosed with a dead liver. His enzymes were through the roof. The MDs gave up on him. He's like, I don't know what to do with you. You got a dead liver. An MD diagnosed him with a dead liver. Milk thistle at pharmaceutical grade will bring down those liver enzymes. This is an awesome product. I got another great story. My wife and I, we met a family, or a couple in Tahiti on our honeymoon. They lived in New Jersey. They moved to Michigan, and they live in Troy now. We've been hanging out with them and stuff. The wife's a medical doctor. I'm a chiropractor. So you can only imagine what our dinner conversations are like. Hop on the medical stuff, and it's interesting because the husband's liver enzymes are up. I'm like, I got stuff to fix it. I can fix him, blah, blah, blah. Well, we might have to do a biopsy of his liver, blah, blah, blah. He's sitting there. It's like, I can't eat bread anymore. I can't look at it. I think if I look at bread, it might affect my liver enzymes. And we're bickering back and forth. My wife's here kicking me under the table. Shut up. Let's just eat dinner. Because I'm not backing down, and I'm going at her. I'm like, your veterinarian knows more than you'll ever know on nutrition anyways, and this pill will do this, and we're just going back and forth. She, shut up. We know what you know. Just shut up. So I'm just going to let him go through the mess before I fix him with his wife there. And it was just kind of interesting there because, you know, I've been on that side. I've worked at the hospitals. I've seen this crap firsthand. I've seen when they brought patients down on hospice, sucking the last life out of them for a CAT scan before they croak, picking them up on a morgue cart, thinking, what's this about? It's an absolute mess. Medicare doles out $50 billion every single year before the last 2 months that someone croaks in the hospital because they rape your insurance. They pulled some of these bills. This was on 60 Minutes. 79-year-old lady. Why do you need a pap smear? 79-year-old lady. Why do you need that? You've been charged by 7 different specialists. 7 different specialists. I only saw 1 doctor. Well, every doctor who picked up your chart on the outside of your room billed your insurance separately. This is why the medical system's a mess. This is why it's in a hole. It's 60 Minutes. You could probably YouTube and find that right there. That's the mess. And then when you finally have something going on and you're like, well, I thought I'm paying $200-300 a month for my insurance. My insurance doesn't cover this, doesn't cover that. What am I even paying money for? Well, people are investing in their insurance. I'm taking that and taking my supplements and investing in myself. It's a lot. It's no money in healthy people. It's all in the sick people. Silly, man. Got a little off track there. Sorry. hepatitis, non-alcoholic, and alcoholic liver damages, abnormal liver function there, exposure to chemical pollutants and orthodox drugs. When we use this product, we're going to attack this when the liver enzymes are high. Do you know what the #1 cause of acute liver failure is? Tylenol. I've seen people stir up their liver with Tylenol, drive up their enzymes. First, we got to make sure if there's anything driving up their enzymes before we attack this kind of stuff here. Got a patient here, I'm not going to say her name, she's using some niacin products and her liver enzymes were in the 400s. That was kind of interesting stuff. You know, it's fine-tuning and being on the right products. It's very simple stuff. Livco, now this is just another Medi-Herb product. Now you look at here, it's got a few different herbs in here. You got rosemary, milk thistle. It's just a different combination with that milk thistle. The silymarin is all milk thistle. This is just a few different herbs in combination of that to kind of help out here with your phase 1, phase 2 liver detoxification. I can't preach heavy enough on top of a daily protocol. I want my 91 things. I'm doing my kaolin, I'm doing my minerals, I'm doing my oils. This is the extra stuff I'm doing. I'm keeping my liver pathway open. I'm not doing some foot bath. I'm not doing some fad diet 1 week out of the year. I'm doing this stuff daily because this water we were drinking, Brian can tell us what's in this stuff. And you don't have to go that far. There's 3 essentials: food, water, air. You're getting hit in every department of that. You want your detox pathways open. Learn to do the simple stuff, the Vitanox, your cruciferous complete. Stay away from those medications. Keep those liver pathways open. Had a lady, she was trying to do all the right things and her vaginal cancer came back on her, and I asked her, what medication are you taking? And she was like, I'm taking Tagment. I'm like, Tagment's blocking up that liver. You got your detox pathways open, and that's why the stuff's coming back. Simple things. Get off that stuff. Liviton. This is a third product right here. Just talking about the liver detoxification here. Dandelion roots, the key product, along with the milk thistle on this one here. A little bit of a different function. You know, your liver and gallbladder work together here. This works a little bit with that loss of appetite, flatulence, nausea, intestinal bloating, constipation. I got no idea who's got that kind of stuff, but this works great for that right there. Your liver produces bile, stores it in the gallbladder, and that kind of works together. Sometimes when we struggle with gallbladder issues, which is one of the most 5 common things that we see, we have to work with the liver to help fix the gallbladder. When people aren't responding to simple beats with the beta food, beta TCP, we got to hit the liver and play that harder. Horse chestnut complex here. All right, this is the hemorrhoids. This is the varicose veins. This is your venous support right here. 2 to 3 per day there. This will take the pain out of your legs with varicose veins in a few weeks. This is how great this works. Cosmetically, it might not take the vein back. It'll tighten up and tensile there and help prevent that. But I've seen some pretty destroyed legs from the medication Vitorn. I had my patient hop on this. He had all this discoloration in his legs. This was one of the pills that helped take that discoloration and the pain out of his legs. It's very cool. So chronic venous insufficiency, achy legs and feet, edema issues, poor peripheral circulation, kind of like the burning issue in the veins is an issue. Now it says restless leg syndrome and trigeminal neuralgia here. This is a virus in the nerve. We're not going to use this for that product. Restless leg syndrome, that's going to be more issues, more with too much calcium in your muscles causing that, you know, achiness and cramps and stuff. We're going to use different things as far as that goes. St. John's wort, this is number 24. This is the closest I could get to a natural antidepressant. The literature supports this one very well. And we're going to use this one a lot more now. Oh, I was doing this thing still. We're going to use this one a lot more now than in the summer because this herb kind of makes you a little bit more photogenic during the summer. Might make you prone to getting a sunburn sooner than later because of this herb. You got to be very careful with this one, but people that have dealt with a SSRI drugs, the antidepressants, and they need something. This is what we're going to use. I got patients been on antidepressants for 30 years. They're early 50s, late 40s, and they want me, I want to stop my antidepressants. I'm like, why stop now? I don't even know if you're going to know what normal feels like. This is a product I'm going to try to wean someone off with this here. But this stuff works good when you use it at the right dose. Excellent question. St. John's wort and valerian should be my next one there. St. John's, actually it's not. St. John's wort, where I went through that, that's right. St. John's wort is an antidepressant. Valerian is like Valium. You got depression and you got anxiety. My depression people, I'm going to treat with St. John's wort. My anxiety people, I'm going to treat with valerian. And I tell you what, everyone wants to look at, they pull up these things on TV and all these people driving bad and they're blaming it on the texting and this and that. A lot of people are on medications out on the road today. Cops are always telling us, I don't find any illegal drugs in the cars anymore. Everyone's on Seroquel, everyone's on Prozac, everyone's on Ristorel, everyone's on Xanax. These other people kind of driving like this. You can pinpoint those real quick. Mm-hmm. Yep. Yes. Yep, you're absolutely right. You got to be careful a little bit with the kava. That's one of the ones they did take off the market very briefly there, but it's people kind of overdo some of the things there, and it's easy to blame herbs with that, but there's a lot of other factors, especially with this drunk driving, and I could absolutely tell you, the judge of novi is a patient in our office. His first question he always asks the patient, or people who's having a DUI is, what medications are you on? Because they're blowing ridiculous numbers, and they said they only had 1 or 2 drinks. It's those medications that 1 drink of alcohol is like 5 or 10 on that. That goes back to that detoxification pathway. Now, St. John's wort, they use this for nerve pain also. This is what that top part talks about here. We use it more for the moderate depression here. It says it's beneficial with the HIV and AIDS patients here because they use this as an antiviral there too. We got other approaches for viral stuff. We're going to use this for more antidepressant and mood issues more than anything. Nerve pain's kind of tricky there too. Last one, adrenal complex. Adrenal complex, you got your licorice root right here, Romania here. This stuff together works excellent. The combination of the herbs works great. Now, these are the people that get dizzy from sitting to standing, low blood pressure. This is the stuff I'm going to use right here. Fatigue, need for extra sleep, difficulty coping with stress, irritability, anxiety, sighing, yawning, things of this nature. But typically the dizziness from sitting to standing, and you get that little kind of whoosh feeling, that's your adrenal glands, and that's your pressure drop, and you need the things to support your adrenal glands. The people that have salt cravings, that's your adrenals screaming at you. You need support. Your adrenal glands cannot decipher the difference between physical and mental stress. It's interpreted as the same by your adrenal glands. This is just talking about the licorice root and how it helps with the cortisol production, whether it's high or low, and it's supporting the adrenal glands here. And Romania here is just the other one there. It talks a little bit about the Chinese use of it in treating the yin, reducing the heat out of the blood. Western medicine here is just more of a tonic for the adrenal glands here. Works great together there. Now, when I get my 91 things and everyone asks, what do you take, what do you take? This is what I'm taking. Keep it in 3, and it's tough to see. This will be on email. I'll give you the email here too. My Catalin, that's my whole food multivitamin. I'm going to do minerals, whether it's my multimins or my trace mineral B12. I'm going to do one of those things here. The PDCM's extra, that's a liquid rare earth mineral right there. My oils, multivitamin, mineral oils. It's as simple as that. Now, if I want to keep my detox pathways open, I'm going to use that Vitanox pill, which was my #1 pill, green tea, turmeric, rosemary, grapeseed extract, along with my cruciferous complete pill to help open and keep that liver pathway open with that phase 1, phase 2 detoxification of the liver. Good, freeze up on me now. My last lectures have been on DVD now, so that's on the handout there. There's some really good ones here. I need to get more copies of them because some of them are already out at the office. Fitness tips, finding the right diet, drug-induced nutritional deficiencies. I enjoyed that one. That was a fun one. Killing the cravings, why we need our minerals. I talk about the 91 things, a little continuation of Dr. Ten's part right there. Balancing body chemistry through blood work. If you get that blood work done in March, that's a DVD you want to kind of interpret a little bit of your blood work there and see how we look at blood work versus your MD. We read blood work very differently because it's very easy to scare people on simple things. My last one is superfoods, and today's is herbs. So, and economy's tough. Things are tough out there. A little bit more economical for a daily protocol. This is $60. It's $1 a day for these packets. You got 3 Catalin, 2 tune oil, 1 trace mineral B12. If that's something that's more economical for you, check into that. We've got that at the office there. Syra, got some things with the Syra that I'm handing out here in a second. Bioenergetic testing, some pretty cool stuff. Picks up a little fine-tuning things that sometimes we miss. You can fax your orders over at the office, or you could order online. If it's over $75, you got free shipping there. Come on. I'm going to break one of these things tonight. All right, that's the end right here, but take down this email address. You go to Yahoo Mail. You use the username DHS Chiropractic. The password is DHS777. This lecture PowerPoint will be up maybe tonight if I'm not too tired, or if not, first thing in the morning. You could sign into that email and you could grab this PowerPoint lecture if you missed anything on the notes. Plus it's recorded, so you could grab that in a few weeks there, and you could see some of our previous email newsletters under the newsletter list if you've been missing some of our newsletters there too. You could cut that out right there. I don't have anyone to test here tonight. And I got one actual announcement there too. Since my muscle testing lectures are booked all the way into June right now, if anyone's interested, Sharon's going to be signing. I got a sign-up sheet back there. I'm going to take whoever signs up. You leave your name and your number. And I'm going to do an extra lecture in February. I got Thursday. I'm going to do that from 6 to 7 at the office for the people who are already signed up. But the second week in February is when I'm kind of doing an overflow for you guys who are here, because I haven't been able to advertise it to the people at my lectures, and they've just been all completely filled up from everyone at the office and elsewhere. But grab your tickets here and we'll raffle off some stuff here. What's that? Last ones. All right, I'm going to go with the last 3 numbers there. 276. Yeah. Next one is 262. Flip back here for you. 262. Valerian, natural Valium right there.